respected moderators, chairpersons, seniors, and my dear colleagues, I thank for giving me this opportunity to talk on the suction in pediatric age population in relation to the stone surgeries. The concept of the Saturday school in urology is a good concept. We'll update all of us with the knowledge. Particularly special thanks to Dr. Madhusudan Agarwal sir, Dr. P. Vilan Murthy sir, Dr. Ravi Kumar sir, and Jagadishwar sir for giving this opportunity. I am sharing the screen now. This is my topic, role of suction in pediatric population. Thanks to Urocare by Alchem. No conflicts of interest. Pediatric stone disease is quite challenging to manage. Risk of sepsis is one of the main concerns. Suction is the need of the hour to overcome sepsis. Suction has been applied in endourology for over 25 years along with ultrasound and ballistic devices. Recently, suction sheets are used during PCNL. Already lot discussed about this topic, but the same applies to the pediatric population. Same benefits like stone fragments, debris, irrigation fluid, clots can be removed. Aim of renal stone management is same principles: intrarenal pressure, renal temperature, improved visibility, operative time decreased, high stone free rate, and minimizing sepsis. In children, particularly less than 5 years children, they are different from more than 5 years children. They are small external genitalia, small urethra will be there. If you see the basic 1 year, 2 years children, the size of the urethra is less than 8 French. Bladder volume is less than 100 ml. Ureteric orifice is less than 1.4 French. So they are very small, 1.4 mm. Kidney size is also up to 1-2 years, it will be 6 to 7 centimeters. The same devices used for suction in RIRS will be used in children also, and PCNL also the same. Now coming to suction in RIS, what are the smallest equipment available? 9.5 French 20 centimeter cook sheet, 9 French 50 centimeter fan sheet, 9.5 French 30 centimeter fan sheet Clearpetra, 45 centimeter FlexX2 flexible ureteroscopy from Carl Storch, 6.3 French 70 centimeters from HugeMed, 7.3 French from HugeMed, 7.5 French from Biorad and Vizimed. This is the smallest size-wise, smallest scope in the world available is FlexX2. This is the small access sheath 20 centimeter. Still smaller are there. 28 centimeters also can be used. 9 by 11 French is the recent change fans access sheath. 9.5 by 11, but 36 centimeters Clearpetra is one of the length shortest access sheath. 6.3 French 45 centimeter HugeMed scope is a revolution. And these are the various ureteric access sheaths in nutshell. And these are visible, flexible, navigable sheaths. And this is about the small sizes. Now coming to the infant fan sheath insertion. Imagine infant fan sheath and adult fan sheath is same. Only thing is 9.5 French are available. These are post-stented cases. So one must be aware of this. Otherwise, insertion is the same. 2 years baby, RIRS we have done with fan sheath. This is the same case. Here we are passing access sheath and then we are passing the flexible scope over the guide wire. Water is coming naturally. Inflow and outflow should be balanced. Better to do error on the outflow side, not on the inflow side. Collapse PCS is better than the distended PCS. And very quickly, this can be removed and see the ureter very, very safe, provided it is stented and postoperatively no stone seen. This is 4 years baby with fan sheath, large stone. Ureter is nicely distensible post-stented. Directly stone is seen with rigid ureteroscope. Large thick guide wire is passed. Normal access sheath is passed initially. Slowly powder is done completely. At the end, you can replace with the fans access sheath by the time you know about the ureter, so that large access sheath will not stay in the kidney for a long time. So these are the sheath. See, this is after the sheath insertion. All the powder is continuously sucked and completely cleared stones without any problem to the ureter and kidney is done. Now this is the 8-year-old baby with the disc and fans. Initially, you go inside. This will be useful for children is disc suction because the access sheath need not be inserted. Here you are making powder and aspirating small powder. At the end, you can use, see, this is the powder we are aspirating. Ideally, it should be done without access sheath with the huge med 6.3 French. Here we have inserted, but we have not removed the scope again and again. Now we are attaching the suction to remove the last pieces of the fragments. These pediatric cases literature is not available, and we have already done 10 cases and all the cases post-stented. This you need not stent, but less than 2 years better to stent. Direct scope suction I already mentioned. This is the way it is done. Already we have discussed in detail. This is the video in direct scope suction in a pediatric age group where access sheath is not inserted. All the powder is sucked like this and removed. So larger fragments will not come. Now suction in PCNL is an old concept. In children, it is same. You have seen here mini perc sheath. So many instruments are there. Ultimately, 7.5 French coral star scope, 11 by 12 ultra mini perc sheath, 12 French super perc sheath are the smallest one. Micro perc from Janat Desai, but suction cannot be easily applied through that. This is the coral chart scope. This is the coral star scope. Olympus shock pulse have also small probes. Same EMS trilogy also small scopes are available. You can see here 12 French, 10.5 French are available for ureter as well as this thing. Clear Petra sheath is also available in smaller sizes with suction. Super perc Shaw sheath is also available. These are the sizes, small size 7 to 9 French, 11 to 13.5 French are available. Otherwise, technically, there is same. Now I am sharing some of the videos. Supine PCNL with large matrix stone. Here the suction is can be super perc Shaw or directly suction cannula, which we use routinely in the theater. After the puncture, once you see the matrix, you can put a suction sheath and then suck it out. See, this is the matrix. And now I am showing how it is sucked out. Sometimes pneumatic lithotripter will not work on that. You just break the suction, the matrix and see how I am sucking. With a normal suction with 22 French, I am sucking out all the fragments. I mean the matrix. Then at the end, clear picture will be there. This is a supine PCNL for 1 year child with matrix stone. You can see multiple stones with the irregular densities in the CT small. This is a small child. So this is the matrix and whole kidney is filled with matrix. The mechanism of suction is direct suction cannula, nothing else. Otherwise, you can use the Clear Petra or the Shaw suction sheath. You can see here, I am sucking out with the normal suction. This is the infant supine PCNL where you can use similar case, severe matrix is present, all the calyces. You can suck out with the normal suction tube. There is no need for special suction tube. Now coming to the 10-year-old child with severe matrix stone. Matrix stone, it is essential. See, this is the suction material. See, I am sucking out like this. This is the most important thing I wanted to show. Where whatever method is suction. This is bilateral super perc where Kaushik Shah sheath is used. This is vectoral syndrome, very difficult for the supine PCNL. So we did prone PCNL by keeping 2 ureteric catheters. See, entire kidney is filled with stones and these are uric acid stones. We inserted the Shah sheath and then you can appreciate with laser round stones. We make 2-3 fragments and automatically these stones are coming out through the sheath. So this is the way it has to be sucked. So this is the Shaw suction sheath continuous, even inside the lumen of the Shaw sheath also you can use this thing. And after finishing one side, other side is also done. Same procedure, there is nothing new, and complete suction is done. Now coming to the conclusion, children are no exception for benefits of suction in urology. Mediation is the key as per children concerned. Small volume stone disc may play a major role in children. PCNL already proved its value in children. RIRS with suction in children needs studies to establish its role. I am sorry that I am physically not able to present. I am ready to take the questions. And thank you once again for giving the opportunity in this Saturday School of Urology. Thank you.